You think of when's the best time to have a kid, regardless of your military or not. Having kids is something we had wanted to do.
Obviously, we were very excited to get pregnant. We found out as soon as we could that it was a boy.
Well, a little halfway through the pregnancy, things were going very smoothly. It's kind of what you expect from everyone else's experience that you talk to and the way that a pregnancy is supposed to go. Then thereabouts 26 weeks or so, Roz's water broke.
We went in and they checked to make sure it was the water that had broken, did some tests and took it to the lab and that kind of thing. And then at that time we got antibiotics. So they started the surfactant at that time too, just because if he was born within the next 24, 48 hours, anything would help as far as his lung development.
After about 8 weeks in the hospital on bed rest, that's roughly the time when Austin ended up being born.
The NICU experience is not what you can even start to imagine. Just scrubbing up to get into the NICU to go see the newborn baby is a little traumatic.
We saw a lot of babies in the NICU that were on oxygen or heart rate monitors and that kind of thing, which is even scarier when these machines are helping your little baby stay alive. So we were very, very fortunate.
He was small, but considering almost 6 weeks early, he was just over 5 pounds and 19 inches, and we're an absolute blessing to us.
At about 4 to 6 months, we started to realize that Austin was developmentally behind where he should be, and so that's when we were referred to Children's Hospital Colorado, and about 17 months, we found out that he had a chromosomal abnormality.
Austin has physical therapy, occupational therapy, speech therapy, all this stuff we can do to essentially help him do the things that really come naturally to these typical 2-year-olds. We have our second little baby boy on the way. We are, of course, thrilled and excited.
We're just at 28 weeks and really counting every day as a blessing that we don't have to go to the hospital or worry that the baby might come. We have our regular OB that we see on a regular basis, but then we also see a fetal specialist just because of everything that happened with Austin and because of his genetic condition. Beyond that, we're doing progesterone therapy and kind of hoping and praying for the best.
A large part of my time in the Air Force was spent on taking care of families. Sometimes the unknown of having a baby is going to wear on you a little bit. And then if you add that into military members and the inherent stresses that go with deployments and high-pressure positions and jobs like that, it creates a unique challenge for a lot of families. There is some evidence that will tell you that the percentage of premature births among military members is higher than that of the general public. And thankfully, the March of Dimes is there to help and to help people understand what causes it, what they're doing to prevent premature births. And we're just so grateful for this organization and what it's done for our family.
March of Dimes helped us so much, and I just felt like it was a privilege to serve on the board and to make more people aware of what March of Dimes does.
It happens more than you think, and our outcome I know is not always typical of it getting to 34 and a half weeks. Babies are born every day at 26 weeks or even earlier.
The research and all the things in NICUs and other things to help moms and healthy babies, it doesn't come cheap.
Whatever amount of money or that you can afford or time that you can give, it makes a difference. If Austin would have been born a generation earlier or even 10 years earlier, his chance of survival would have been significantly lower. And it's just the same as while Rosie was on bed rest, every day that Austin could stay inside made a difference. Every single day that March of Dimes is out there doing what they do improves the lives of someone, whether it's you or whether it's your child's child if you're a grandparent, or whether it's a friend or whoever it is. This work matters. It makes a difference in the lives of people.